Hey everybody, I'm Brodie West, and I'm just going to start giving an introduction about the presentation that Stefanie, Webb, and I put together for you guys. We were talking about the clinical informatics of the electronic health record and the clinical applications that are used within it. We just kind of wanted to get you thinking about something that we use every day in clinical, and something that you guys might not really think about whenever you are using it, about kind of how easier it is for you and everything, about how it can benefit patients and other people that are involved in healthcare. We wanted to tell you guys a little bit about the innovation of the electronic health record and how it is that we can use it to better share data and other information regarding patients. And another question that we really wanted to kind of get you guys thinking about is, will there ever truly be an interoperable system that is used nationwide? We want you to think about the long-term benefits, not only for employees and healthcare workers as far as not being as stressed out and kind of having everything in one place, but how is it better for our patients that we're caring for? So we broke this down into 5 lessons because we figured that would be the best way to do it. Lesson number 1 is electronic medical record versus electronic health record and components. And this is obviously just comparing the difference between what is the difference between the electronic medical and electronic health record. Lesson number 2 is just terms and perspectives, and it's just kind of things that we wanted to get you thinking about and to kind of show you the difference between how it affects the patients, which is referred to as the consumers, and the nurses that use this every day, nurse practitioners, even insurance companies and the national government and state governments. Lesson number 3 is how the electronic health record was adopted in the health practitioner. So basically the steps that kind of got the ball rolling as far as this being mandated more of a kind of nationwide thing, and how it is that healthcare provider, the healthcare practitioner can use this to better care for patients. And lesson number 4 kind of is similar to 3 as far as the health practitioner component. It's the clinical applications of the electronic health record. So this can be like your barcode scanning and stuff that's kind of implemented as more of a patient safety, and your documentation, stuff like that, that kind of compiles everything together so that it's all in one place. And lesson number 5 is just a summary of the main issues and what can be a problem with having an electronic health record, especially if it is implemented nationwide, and how it can affect healthcare for not just the healthcare workers, but also our patients that we're delivering care for. Okay, so the next little bit that we're going to talk about is just kind of like a brief overview as to why it is that the electronic health record even really kind of got started and why it is that people think that it is important. The biggest reason that's mentioned is that the healthcare in the United States is very complex, and not only in just with managing patient information and data, but it's really kind of hectic no matter where you look as far as patient turnover rate, and especially patients being discharged and ending up right back with a readmission. But it makes it a lot easier as far as handling the data. And obviously, if you have a paper record compared to an electronic, you can set and just say, you can search for certain things as far as if I need to look up a patient's diet or their allergies. 9 times out of 10, there's a little separate section and you can just find it easy. Or if someone else is digging through it trying to find something else and you just need to follow something right quick, you can use it simultaneously with somebody else, which makes things in healthcare a lot easier, especially during the hustle and the bustle of what is healthcare in the United States today. We want to also make an advantage as far as collecting, sharing, and processing patient data. And that makes it a lot easier as far as government keeping up with maybe certain illnesses that have been contracted, financial incentives being offered as far as with like Medicare, Medicaid, as far as stuff like that, and the hospitals getting reimbursement for the charting. They have an easier way of keeping up with everything that they need to, especially in regards to if a patient has a bed wound, or bed sore, they can better track how it is and it has progressed and how it has gotten better, or you can document that they had it before they arrived. That way the hospital doesn't get charged for it. It's just a whole lot easier on the hospital as far as everything goes with that and the employees that are within that system, just because they do kind of have a more compiled place of finding everything it is that they need. Another thing now is a lot of places are finding that if they haven't really adopted one that is interchangeable, there's actually financial incentives that are being offered now just to kind of get everybody more on the get everybody more on the same page. All right, and now to kind of get into more of the fun stuff, we're going to talk about what's the difference between an electronic medical record, an EMR, or an electronic health record. And the biggest difference between an EMR and an EHR is the electronic medical record is really an all-inclusive. It's going to be more specific to a certain institution, and it's not going to comply with outside programs as far as data being transferable and everything. And it's more controlled by the provider and easier for them. The electronic health record is going to focus more on holding data and crossing and being able to interact with other records, and basically really interchangeable and more of a lifetime record, and can be more used anywhere and with any setting. There's a lot of components of the electronic health record. You can see on the slide about it that's referring to Table 6.1, the electronic health record components from the IOM of 2003. And it really just kind of adds an entire support. As you can see, it's for administrative process, decision support, health information and data, and so on and so forth. So that allows people to do admissions and register them and schedule appointments and do everything kind of within the same place. Lab, pharmacy, radiology can work together. Discharge instructions can be used. Health management can be attained, and just kind of helping the patient keep up with what it is that they need done next. It really just kind of helps make everything easier on the patient in a sense, as far as keeping up with what is the next step. And a lot of these, whenever you discharge somebody, it'll include when their next appointment is, what it is that they need to follow, why it is that they would need to come back, stuff to kind of focus more in on the patient and to keep them from having to come back, and to keep everything in one place and kind of make it easier on them. This also clearly makes it easier on employees because they can look and see what labs they've had drawn, when was their last admission, are they being readmitted for something that maybe wasn't completely corrected the first time, and stuff like that. And that it's a lot easier to see how it is that maybe in healthcare we can step up and be a little better for our patients. Now, in regards to the terms and perspectives, we'll focus more on the terms for right now. And this is just really kind of what it is that you need to be clarifying within the system, and as far as what is the overall perspectives of the electronic health record. So as far as terms that need refining, or to be more specific and when in use, is the biggest example is CPR. And, to us, we immediately think of cardiopulmonary resuscitation. But in regards to this, in the electronic health record, it can be an understanding as computer patient record. And, obviously some people aren't going to be like, let me see that CPT on patient in bed 20. And you want to think that they're meaning CPR, but they're really referring to something that is in regards to their record. And, we normally don't throw that around anyway, but it's just one of those things that we kind of need to think about and make sure that there's not a cross meaning in referring to a patient, everything, and just kind of be aware of that and refine and clarify as needed. As far as the overall perspectives of the electronic health record, there's a lot of benefits, such as a decrease in medication errors, which obviously increases patient safety and the quality of their care. It can save time for the people that work directly hands-on with the patients. And like I mentioned earlier, you have real-time access. So if you need to see something right quick, it's a whole lot easier to kind of go and pull something up as opposed to flip through a paper chart. We can also use this as far as decision support, and that's kind of like I mentioned earlier with looking for, is the patient NPO? Do they have an allergy? Is there a reason I can't give them something? And with this, a lot of times you have educational resources that are built in. So if you don't know if a drug is compatible or not, a lot of times you can look this up and sometimes it'll even flag for you if you're questioning. It improves compliance and communication between the patients and healthcare providers, just because they can, like I mentioned earlier, they can keep track of everything, and it does kind of make everything easier on them if everything is in one place. If I know that I'm admitted to the hospital for pneumonia, I know that my healthcare, my PCP can see that and know what's going on, and they can easily coordinate care a whole lot better, as opposed to one being on one system, one being on another. And it makes it easier on the patient in this sense, as far as everything being interchangeable. Another thing in regards to electronic health records is the stakeholder perspectives. And this is basically an overview of the people that are involved, their point of view, and how it is that it affects them. And this includes your nurses, your consumers, or your patients, the healthcare providers, the healthcare organizations, the insurance payers, and the state and the national government. And there's kind of a lot that goes to this, and it's just kind of stuff that has been mentioned before, but it's more to think about how it is that it's affecting every chain that's used in the link as far as healthcare. So for the perspectives, we'll start with the nurse's point of view. And I figured I'd start with this one just because it kind of makes more sense to kind of start with it, just because nurses are the ones who use it more as far as directly hands-on. But for nurses, this provides a very, very extensive resource for as far as patient education and kind of making things a lot safer for the nurse. Like I mentioned earlier, there's stuff that keeps them from making medication errors or giving things that shouldn't be given as far as drug interactions. This improves clinical documentation because everything is in one place. You can have more support of compliance with regulatory requirements and everything like that. And this also helps them to improve the discharge follow-up for patients and makes it easier for them to monitor the patient status. In a lot of these systems, you can kind of see how it is they are progressing, and in the inpatient setting, you can see how it is that they are getting closer to being discharged and what are the next steps that need to be taken for that patient. Next, we'll talk about the consumer's perspective, and this is just kind of reiterating stuff that has already been said. It improves their quality of care. It provides appointment reminders, saves times for them because everything is in one place, and it reduces duplicated tests and services because they can see what's being done. And if they do have more than one provider, they can sit and see, oh, I've already had my routine blood work for this year. I don't need to have it redrawn, which increases their likelihood to be involved in general, and to also keep them from overpaying or being charged duplicate services for it. And it really just is one of those things that they know more of what's going on. And in some cases, this can make it easier for them to understand what is going on in their healthcare because they have access to it. They see what's going on. They can see how it is that they're getting better and what it is that they need to work on. And on to the next perspective, we'll talk about the healthcare providers and their perspectives on things. And this isn't just limited to your doctors. This is also your nurse practitioners and your physician assistants. This increases their efficiency to bill and care coordinate. They can see what's been done and go from there. They can access current and past medical records so they can see any pertinent past medical history or anything that's been done. They have an easier access to stuff like this. And this helps it be easier to store their information that it is that they're collecting now, which obviously helps them in the future and helps them to better coordinate care if the patient does see more than one doctor. And it really just kind of helps to better the communication between the patient and the physician. Like I mentioned in the consumers one, they have more access to it. They can see more of what's going on, and it's easier for them to ask questions about stuff that they don't truly understand, but they see it in their chart, and it kind of does make them curious and want to know more. And so this overall can improve the function of the office because everything is in one place. And that's probably very repetitive, but that's really the entire gist of the electronic health record. Another stakeholder perspective is the healthcare organization. So this isn't just like one individual hospital. This is the group of hospitals or facilities that an organization is over. And the biggest thing for them is that it improves efficiency and strengthens communication. That's really the biggest points that they want to focus on. And so by doing this, you also increase patient safety and support compliance, but it improves the record security and the storage, and it improves care coordination and enhances the quality of care. And the biggest reason that healthcare organizations are for this is because it does make things easier on their employees. So it's kind of one of those things where if you keep your employees happy, they'll stay and everything. And this also helps them better care for the patients. So they're not going back and forth to try to care for their patients by going in and out of systems and trying to keep track of what's going on with their patient. Okay, and the last two stakeholder perspectives that I'll talk about is the insurance payers and then the state and the national government. So obviously with the insurance payers, that's going to focus more on your kind of reimbursements and stuff like that. And so that's one of the biggest things is that it's the pay for performance requirements that are submitted a lot quicker. So it makes as far as the patient getting their stuff covered by insurance a lot easier, or any reimbursement that needs to be done to the doctor a whole lot quicker and a whole lot smoother as opposed to the old paper way. This also allows for more efficient disease management and reporting, which does make it easier not only for insurance payers, but as far as regards to the national government as well. Another big thing too is that with the insurance payers, as far as this, a lot of the coding and billing is already done. So it does make it easier for the employees as far as what it is that they have to do, because most of it is already done for them and they just have to control the costs and help submit it. In regards to the state and national government, these are another bit that's really repetitive. It improves the coordination of care and the quality of care, and it helps reduce medical errors, not just with medication, but anything else. And that's another one of those things, like I mentioned, it helps share data, and it provides a database that's easier for the public health and research. So if they are finding trends, it's a whole lot easier for them to look at this and identify it. And it improves just the overall health care for citizens in general. All right, but that's all that I have for you guys, so I'll pass it over to Stefanie and let her tell you more about how the electronic health record has become more nationwide adopted and just some more benefits to it and what's to come with it in the future.